Dr. Jaffe, this next question comes from one of our PIH Academy members, and she's asking if you could please speak to testing TMAO, specifically regarding its accuracy in determining if an individual has increased risk for cardiovascular disease and monitoring therapies to reduce it, and also to aid in determining altered gut microbiome.
Yes, an important question about TMAO, which forms only when you have a long transit time and only when partially digested food remnants get to the colon. So the answer to TMAO, which is hard to measure and hard to interpret in an individual case, is to have a healthy transit time, that is a digestive transit time, a healthy digestive transit time of 12 to 18 hours based on the digestive transit time test that we have put into a easy for consumers to perform little package. It's one of the 4 self-assessments. And yes, if you eat foods that you can digest, assimilate, and eliminate without immune burden, if you follow our LRA by ELISA Act results and plan, you will move, like most people, from a long to a healthier, shorter transit time. Now, you could be less than 12 hours, and that would be another problem, but you could be more than 18 hours, and that's the category of people who have partially digested food remnants in the colon too long because of long transit time. And that's where the TMAO forms. And yes, it is a risk factor, not just for cardiovascular risk, but for chronic disease in general. So long transit time, identify and correct. Healthy transit time, 12 to 18 hours. You get there with our eat, drink, think, do combined program, eating the foods you can digest, assimilate, and eliminate without immune burden, taking the supplements, doing the activities, mental and physical, that help you restore, rehabilitate, recover your health.